Onas gur uche ho sofer ar nila vrihir, agus ar nila gynnu fasta, agus gur triad o Christ no free, tri Christ ar dearna. Direct, we beseech thee, O Lord, our actions by thy holy inspirations, and carry them on by thy gracious assistance, that every word and work of ours may always begin from thee, and by thee be happily ended through Christ our Lord. Amen. Okay, Tamid contusnu initial roaches agus keshna con an Taoiseach a Taoiseach while let Laurtling ta denno made agat.
Germagat can Carla. Wallam Mwiaka Sagaul and Winter Naharan as an defriacht war a rinishid condoling lek la Covid and EJ. Ta an cor a wailu a going agus ta an quidus massa den roag heart. Ta na milta dini savalta going. Ni hori ober an Verna Ospedale agus Locht Chorum Sláinte Urhu. Den Owen Shin tá an Omerca Cossan a nua going agus tá an Omerca Dini ag fáil bás go fáil. Curn sin in úl doing galéhul gwilmid fósa géirí smacht cur an acid. Mar seoldíomh tá plana going chun an tíre oscailt bhealach adálig céim chéim. Tá cuaig céim ann agus trí seachtainna athrthú go léir ag tosnú an 8 lá déag de bealtainna. Buine sé tamama ach choki ar sail ar as beagnach mar bhí ribhe seo ach beg gan an nua i gceist. Ba mi dábalta sólás crí a thuirt dá chéile go pársanta. Ba mi dábalta daoine a chur as ag obair. Ba mi den ann a bheith buartha brónach a deanta a chéile. Is í an teachtarach ismó atá agam. Tá gach duine atá ag fécant ná gur fiú na híbertí a rinne sibh. Tá na mílta daoine sábháilte dá bhar. Is í an aim atá going inis ná an gníomh a thosaíomar a chur agriach. Ceann Corla, foremost in our minds are those who have lost loved ones because of Covid-19 and all who are suffering from its impact, physically, emotionally or financially. As of last night, 143 people have died since we last met in this format last week, and I offer my condolences and those of the House to their families and friends. Due to the decisions, choices and sacrifices of the Irish people, the curve has been flattened. It has plateaued, but our grief has not. We now have a roadmap for how we will bring our country to a new normal, and the stakes are too high to rush things now, or we risk everything we have achieved. As we start to ease the restrictions, we must continue our commitment to the basic actions, such as cleaning hands and physical distancing. And we must try to find, isolate, test and care for every case and trace every contact. As we ease the restrictions, personal discipline around physical distancing and hand washing and respiratory hygiene will become more important than ever. As of yesterday, just under 215,000 tests have been carried out in Ireland. Over the past week, close to 62,000 tests were carried out, and of these, 2,280 were positive. That gives us a positivity rate of 3.7%, a rate which thankfully is continuing to trend downwards. 65,000 tests have been carried out in long-term care residential centres, including nursing homes, and 540 nursing homes, or 93% of the total, have been tested so far. This testing continues. During the course of this COVID emergency, nearly 3,000 people have been hospitalised, and 78% of those have made a full recovery. Some significant developments have taken place since this day last week. The HSE is increasing its testing capacity, which now stands at a capacity to test 12,000 people every day. And by mid-May, we're aiming to have a capacity for 15,000 tests per day. The total number of tests now done, as I mentioned earlier, is 215,000. That's 43,000 tests per million population. Depending on how you measure it, we're between 3rd and 7th in the European Union of 27, and we're now well ahead of countries that led the way previously in testing, such as Germany, South Korea and Singapore. But we need to focus also on turnaround times and rapid and aggressive tracing. One of our focuses from the very start was to build surge capacity in our hospitals. We needed to ensure that we had maximum possible number of critical care and regular hospital beds, so we could cope with the predicted number of COVID cases requiring hospitalisation. We need to remember that the 3,000 people who have been hospitalised so far have come from all settings, some from their own homes, some from nursing homes, some from other forms of care home. They are young, they are middle-aged, and they are older. The whole point of increasing critical care capacity and hospital capacity was because that's where the sickest will end up. 3,000 people have been hospitalised with COVID to date, and it's good that we haven't run into issues with the availability of critical care beds or ventilators. It could have been very different. The willingness of people in every village, town and city to follow the public health advice changed the future. It meant that our hospitals have been able to cope and our healthcare staff have not been overwhelmed. This success, however, has brought a different challenge, and we need to now work out how we can manage separately COVID and non-COVID care for a prolonged period of time. This isn't going to be easy. It means we need to provide care and services in new ways, like increased use of telemedicine and online clinics, increased use of hospital in the home, while ensuring that patients are confident about the quality of their treatment and reassured about the safety of the care they receive. For those feeling isolated, I know how easy it is to become anxious and lonely when you have to spend a considerable amount of time on your own, especially if you're a sociable person by nature. But please do remember that help is always available. Please reach out to a friend or family member and contact Community Call. We're waiting to hear from you. Ceann Comhairle, last Friday we published our reopening plan, and since then indicators are that we're going in the right direction in terms of the positivity rate. ICU occupancy is now down below 100, in fact falling towards 80 today, and we're increasingly confident, though it is not yet certain, that we can proceed with Phase 1 on Monday the 18th of May. Cabinet will make a final decision on that on Friday the 15th, following advice from NPHET. I know that we've faced some criticism that our plan to reopen the country is at a slower pace than other countries. It is true that it's slower than countries much less affected than us, like Australia and New Zealand, and slower than countries much worse affected than us, like Spain and Belgium. This is a decision the government made on foot of advice from NPHET, and it's one we stand over. I would rather have a plan that we accelerate if things go well, than one that we might have to pause or draw out or go back on if they don't. We're putting the lives of our people and their health first, and we don't want to have to reimpose restrictions like some other countries have had to do so. This would damage public morale and further dent economic confidence. We want to learn from the success and errors of other European countries reopening before us. And it is encouraging to see the data from Germany, which indicates that their reopening has not yet led to an increase in cases. I think this is a prudent, precautionary and health-led approach. The government is keen to hear from sectors and businesses who think they can open more quickly and see if there are plans for how they will achieve physical distancing and what precautions they will put in place to mitigate the risk where they cannot. Our objective is to help the country get through this emergency, rebuild our economy, get people back to work and keep them safe while doing so. We're currently working with business unions, the Health and Safety Authority and the HSC on the development of a return to work safety protocol to assist this. According to our most recent figures, 598,000 people are receiving the COVID-19 pandemic unemployment payment. This is on top of the 205,000 people on the live register. So a total of 803,000 people are now receiving some form of income protection from the state. As we know, we came back from the last economic crisis and we achieved full employment. I believe with the right policies we'll do so again, and with the right policies the recovery will be quicker this time. On Saturday we announced an economic plan worth up to €6.5 billion to help businesses impacted by COVID-19 and minimise the economic damage done by the pandemic. Commercial rates will be written off for 3 months. A €2 billion credit guarantee scheme will be introduced for small and medium-sized enterprises, and our Sovereign Wealth Fund, ISIF, has been mandated to invest €2 billion directly into bigger firms. Maintaining the link between employers and employees will enable a quicker recovery, and the wage subsidy scheme will help keep staff on the payroll. There's also a €1 billion COVID-19 funding package to help businesses with cash flow, and banks will also be able to dip into their rainy day capital reserves to keep lending flowing, freeing up £1 billion in bank capital to provide up to £13 billion in credit. Meanwhile, a suite of taxation measures will alleviate short-term liquidity difficulties. Ceann Comhairle, I'm keen to see a return to international air travel as soon as is feasible and safe. There's a lot of work to do, but I am optimistic. I am more optimistic than others that air travel for business and leisure will resume this year. Currently, there's important work being done by the European Commission and various aviation safety agencies, and I hope to give an update on this to the Dáil in the weeks to come. Ceann Comhairle, we're still learning about this virus. It's noteworthy that initial reports suggest, from retrospective testing, that the virus was circulating in France as far back as December last year. That's before the virus even had a name or a test for it. In some ways, this is not surprising. France is well connected to China, with dozens of flights every day, and Ireland is well connected to France. Indeed, it is very possible that this virus was already in Ireland last year, or January this year, and we should not assume that it came here from Italy in late February, just because the first confirmed case did so. Further research and retrospective testing will give us a better idea, and time will tell. Ceann Comhairle, as we know, the coronavirus is the shared enemy of all humanity and all governments. And I believe the only way we can defeat a global threat is by working together on a multilateral basis. Working together, we can develop an effective vaccine, effective treatments and testing systems. So Ireland has contributed £60 million in direct or repurposed grants to the United Nations and has quadrupled our contribution to the World Health Organization. On Monday, on behalf of the Irish people, I pledged £18 million to Gavi, the Vaccine Alliance, so that the poorest and least developed countries in the world will have access to the vaccine if and when it is developed. And we're providing about £10 million over 3 years for immunology research. The Department is also supporting the WHO Solidarity Study, which is comparing 4 treatment options, including remdesivir, which is available to Irish patients under certain circumstances. By recruiting patients in several countries, and shortly here too, the trial aims to rapidly assess the impact of these treatments in slowing the disease or improving outcomes. As always, Ceann Comhairle, I look forward to hearing members' comments and observations.
Thank you, Taoiseach. Deputy Micheál Martin, please.
Good morning, Ceann Comhairle. In just over 2 months, 1,375 people in our country have lost their lives during this pandemic. Our first thoughts must continue to be with their families and loved ones, and indeed with those who are today fighting with the virus. There is no question that our absolute priority must be to continue to limit the spread and fatal impact of Covid-19, and that this work will continue for some time. During this session, there will be many hard questions asked concerning the government's actions, and this is exactly as it should be. Particularly as we join other countries in moving out of the most restrictive phases of the response, there are many issues where there is no simple answer and different approaches are possible. Last Friday's publication was welcome, but it has raised almost as many questions as it answered. It is a framework for reaching decisions. It does not provide the level of clarity which could have been expected. The 5 tests by which different elements of the restrictions can be raised are reasonable, and they have been on the record for some time. However, we have absolutely no clarity about what the specific triggers are for lifting, retaining or reimposing restrictions. In the absence of a clear assessment of the current status and future requirements, the tests provide no clarity. For example, the critical issue of increased mortality from non-COVID cases has now been identified as a consideration. What is the current assessment of the extent of these deaths? How will it be monitored? At what level will this factor come into play? It's a very serious issue in terms of the non-COVID stream in our health services and in terms of both primary care and acute care and the absence of people coming forward and so forth. In contrast, other countries have been far clearer in saying exactly what they mean when considering pressure on hospital capacity, the replication of the virus in the community, the availability of testing and other factors. As we've been pointing out for many weeks, in key areas Ireland has taken a quite limited approach to the publication of real-time data and the quantification of problems. Following the publication of the framework last Friday, we need to move on and to take a more open and rapid approach to the publication of all data relevant to the 5 tests. Different sectors of our society and economy need to be enabled to come forward with specific proposals for how to lift restrictions while respecting public health advice. Given the amount of time and effort which was put into preparing for last week's announcement, and the fact that it was withheld until a wide range of advertising and other publicity activities were ready, it is surprising how many specific issues are not addressed in the document. The failure to consult with the Northern Executive is inexplicable. Hopefully the Taoiseach will clarify that this was an oversight which will not happen again. This is not an area where high secrecy is required. In fact, the absence of enough consultation is clear in parts of the document. The situation in relation to the Leaving Certificate is unacceptable. Every single government in Europe has been confronted with how to complete school leaving exams and prepare for a new higher education year. Nowhere has there been such a lack of clarity and confusion. The fact that the reopening document published last week failed to address it is remarkable. We are now beyond the stage where clarity must be provided, and the government must be honest about the ability to complete the Leaving Cert in the coming months. On Easter Monday, our spokesperson sought a briefing on the public health advice in relation to exam classes and exam sittings. He has never received this, and it is our understanding that the Exams Advisory Group has also not received such a briefing or such public health advice. How is it, then, that arbitrary dates can be bandied about without providing information about the public health limitations for what can and cannot be done? Why have members of government talked about starting dates for exams without any detail on how this can be accomplished? There is no way of addressing the concerns and preferences of every student, but there are basic principles of equity which must be addressed. In recent days, I've heard from teachers and principals in many parts of the country about how certain students simply are not able to match others in terms of home-based learning. One principal in a Desh school told me that his best student has nothing more than a small smartphone to rely on. Other students have family members testing positive, with obvious implications for their capacity to study, given the need for parents to self-isolate. Policy cannot be set based on assuming that every student has a laptop, a room where they can learn alone, and a school which has the resources to teach online. I'm genuinely surprised that there has been nothing published so far by the government assessing what the teaching and learning environment has been for Leaving Certificate students in the past 2 months. Agus an óhéhan áirteiste, tá brú ú fásach na Mic-Léin fi láithir. Is dochreite an aspas léirú atá ann fi láithir. Agus tá sé riachtanach inis cinenne a dhéanamh. De raibh dalribh, ní raibh mórán caintine, nó cóirla ag tacht agus idir an Rhaine Dachis agus an Rhain Sláinte, nó ní bhór a Dachis éon chóirla ó na Hifigi Sláinte priblí. An bhfuil sé seo fíor cén fá. Nuair a Dáil siad an roadmap ar nína, nuair luigh an rialtas éon rud faoin ardteist. Tá cinenne déinte ag beag nach gach tír eile san Eorop, mar leis na scrúdathe. Ad a bhíam nach bhfuil sé éasca, tá sé dachar, an rud is dachra a hiiscint, ná conas an ardteiste agrú I ggóhéics an cóirla atá ag tacht go generálta ón Hifigi Sláinte priblí, agus atá léirithe san roadmap. Measan go bhfuil sé dothíonta. Ar éon ós tá sé ná cinenne a dhéanamh agus plán darafach a chur a bhain. And as well as bringing some finality to what is to be done about completing the leaving, there is a need to urgently give guidance and support to the higher education sector. The financial crisis caused by underfunding in recent years has now been followed by a financial meltdown. The broad dimensions of this are getting clearer as overseas enrolments for next year have effectively disappeared. One constructive step which could be taken immediately would be to agree to expand the number of places in third level available for Leaving Certificate students this autumn. This would help reduce the impact of the points race and potential disputes concerning grades in the event of an alternative emerging. In many cases, this would also ensure that we would not see a decline in places in important faculties because of the decline in overseas enrolments, where there's already an excess of qualified candidates applying for places. I can think of medicine, finance, computing and other areas. The failure, I think, to show leadership in relation to what is happening with the Leaving Cert in higher education must end. The consultations which were held yesterday need to be maintained on an intensive basis with hands-on ministerial engagement with a view to a concrete proposal being agreed and emerging. On Saturday, Minister Donoghue announced a range of economic measures and repeated the fact that we are facing a series of economic, employment and budgetary shocks which are unprecedented. There are today over 1 million people receiving some form of emergency payment. This is the highest level of state support ever recorded, and anyone who suggests that policy responses should set a new normal is being both misleading and cynical. No one has suggested that we begin a fiscal retrenchment in order to restore access to lending, but to claim that there are no budgetary concerns whatsoever is empty politics. The critical challenge we face is how to restore as much demand and employment as possible, and to do so as quickly as possible while respecting public health limits. As I have said during all of our recent sessions, the treatment of Debenham workers is outrageous and unacceptable. I hope we will hear more detail today about what is being done to make sure that some companies do not exploit the pandemic to deny workers and creditors their rights. Equally, I hope we will have a greater acknowledgement today of the vast majority of businesses which are desperate to hold on to their staff and to get back to work as soon as possible. My party has heard from businesses throughout the country which are doing everything they can to keep their staff and are developing detailed protocols for how to restart and respect health guidelines. Unfortunately, we have still not received any information about the impact of the pandemic on state companies and local authorities. What is the current scale of the financial hit which they have taken, and how are they to be protected? Public transport is critical to our society and the economy, yet we've heard nothing about how public transport companies are to be helped and what limits they will face before full reopening. The evidence from throughout Europe is that masks are a critical part of a widespread return to using public transport, and this needs to be addressed here. There's more than enough public health evidence of the benefit of face coverings, and there's no evidence that the supply of PPE will be undermined by introducing a requirement for face coverings in at least certain public situations. This has been under consideration for long enough. I think it's time for a decision. This week we begin to restore important parts of parliamentary accountability and oversights. The national will to fight and overcome the pandemic is as strong as ever. What we need now is greater clarity and openness in deciding on future steps. Thank you,
Deputy Martin. Deputy Mary Lou MacDonald.
So, Ceann Comhairle, I'll speak for a number of minutes and then I'd like a response from the Taoiseach and then a response and so on. Can I start by sending sympathies again to all of the bereaved, to extending solidarity to all of the sick and wishing them a full recovery, and to again set out our thanks to every worker on the front line, and also to acknowledge the efforts of our people as they live with extraordinary public health restrictions on their lives. I listened with very great concern yesterday to Paschal Donoghue as he indicated that a cut would be made to the Covid-19 payment and the wage subsidy scheme in June. I want to say at the outset that cutting or tapering off these interventions and supports is wrong. Such a decision would represent a serious blow to workers and families who have lost their incomes as a result of this pandemic. Because when a person loses their job, as we know, they still face the cost of living. Bills still need to be paid. Money has to be found for the mortgage or the rent. Food must be put on the table. Children have to be provided and planned for. And those of us living in the real world know that €350 a week is the bare minimum needed to keep a show on the road. We know that it's the bare minimum needed to make it to the end of the week. So to cut this payment would be to pull the rug from under the feet of so many and force those who can least afford it to pay for the economic fallout from this emergency. Ceann Comhairle, that such a move is even being floated at this stage suggests that Fine Gael remains out of touch with the lives of workers and families, with those bearing the brunt of this economic shock. The comments from Mr Donoghue sent a shiver of apprehension down the spines of those who suffered untold hardship as the result of the vicious cuts meted out by both Fine Gael and Fianna Fáil over the past decade. Indeed, Many families were still struggling with the financial impact of your austerity policies from the last recession, just as the pandemic hit. And those people remember the deluge of mean-spirited cuts of that era. They remembered that in the last economic crisis, Fine Gael and Fianna Fáil chose to protect the banks and the wealthy, and that you chose to punish ordinary workers and families instead. They lived with the minimum wage being slashed. They lived with the numerous cuts to child benefit. They lived with the profound damage done to our public health service and to our housing system. Slash and burn policies aimed to service a debt that did not belong to the people. And at the same time as this suffering was heaped on ordinary people, Fine Gael and Fianna Fáil still managed to ensure tax breaks for the vested interests and massive payouts for bond holders. Now, it's not lost on anyone that words like unaffordable and unsustainable are rattled off and deployed to describe financial measures that benefit ordinary people. But somehow money and resources are always found to preserve the privilege of those at the top. You see, I suppose on the Fine Gael street, banks are systemic, but securing the livelihoods of workers and families would always prove just too expensive. The reality is that we will have an unemployment crisis well beyond the summer. Whole sectors of our economy will need more than a couple of months to recover, to get back on their feet, and workers will need to be supported and protected. Workers and their families need stability, they need certainty, and at this point in time they do not need announcements from government that the €350 a week that they currently rely on is about to be cut. In fact, such an action would contradict the promise made at the outset of this crisis that ordinary workers and families wouldn't be thrown overboard on this occasion. It would signal that the motto of "we are all in this together" was just a slogan in the end, used to garner public goodwill. It would provide a telling glimpse of what's in store for workers and families should a Fine Gael Fianna Fáil government transpire. So there can be no return to austerity, and be in no doubt that this is your first test. So I want to ask, will you, Taoiseach, give a commitment to the Dáil and, more importantly, to the workers and their families that the payment of €350 will be maintained at its present rate and extended beyond June?
Thank you. Taoiseach.
Thanks very much, Ceann Comhairle. The temporary wage subsidy scheme and the pandemic unemployment payment of €350 a week have protected those who lost their jobs in a way that I think was appropriate and was right to do. I think we all acknowledge that it cannot last forever. It was an unprecedented action, and it's not affordable for it to last forever. And I think the vast majority of people in the country understand that. However, it will need to continue, at least until people have the opportunity to return to their jobs. And for the vast majority, that won't be possible before mid-June. So yes, it will need to be extended beyond mid-June, and I'm happy to say that here in the House today. I am sorry, though, that Deputy MacDonald chose to become so party political in her contributions, because what she said was so two-faced and so fundamentally dishonest. My party, Fine Gael, never cut the minimum wage. Working with Labour and then with Independents, we increased it by 25%, one of the highest in the world. What is the minimum wage in Northern Ireland, where Sinn Féin is in power? In this jurisdiction, a government led by my party introduced a pandemic unemployment payment of €350 a week, so that people who lost their jobs had some financial security. What happened in Northern Ireland, where Sinn Féin is in office? £100 a week. Nothing for the self-employed until June. And Sinn Féin ministers on their Facebook site promote the fact that they hand out food parcels to the poor, reminiscent to me of Donald Trump handing out toilet roll after the hurricane hit the islands in the Caribbean. Sinn Féin's leader here in this House, Deputy MacDonald, is an opposition party leader. That's fair enough, and she can criticise what we do, say it's not enough. She can do that every day. But she can't hide the fact that she's also leader of an all-Ireland party, a party that's in power in Northern Ireland, where the minimum wage is lower than here, where you don't give people £350 a week. you hand out food parcels and boast about it on Facebook. I'd be ashamed to do something like that.
Time is up, Taoiseach. Thank you.
And don't blame it on the Tories, and don't blame it on London. If it wasn't for their money, it'd be even worse.
Deputy MacDonald.
And of course, the budget in the north is a subvented budget. You're quite correct. Unlike the budget the budgetary parameters that we have here, I'm glad to hear the Taoiseach confirm that the payments will be extended beyond June. Will he indicate for how long will these payments be extended? Will he indicate that the level of payment at €350 will remain the same? Will he indicate also if he could be more ambitious in terms of the supports for small and medium-sized enterprises and micro-businesses? Because what he left out in his exposition of the North is in fact that grants of £10,000 sterling or £25,000 sterling are being made to businesses across all sectors in the economy. In fact, what has been dedicated to those efforts in the 6 counties is far greater than the entire £250 million, which is pretty miserly, that's been set out here. And businesses are contacting, I'm sure, all of us to say that is inadequate. Can I just also say, Ceann, I'm very proud of the community work that our activists do right across the island. And, you know, it's not just in the north where people are running Meals on Wheels and bringing packages and parcels to help people who are struggling. Today, the St Vincent de Paul launches their fundraising effort in acknowledgement of the fact that we have a lot of needy people. But I'm glad that you've changed your mind in terms of cutting this subsidy and income support scheme. So at what rate? Is it still €350? And for how long will you extend this payment?
Taoiseach, we've less than a minute here.
No decisions have yet been made on the rates or on the timelines. That may yet be a decision to be made by the next government, if we have a new government by then. But if we don't, then obviously this continuing government will have to make that decision, and will make it well before mid-June, and will give people plenty of time for that. I think it's a great thing, by the way, that people do provide food banks and hand out food parcels, and this government actually funds food banks, and we've done that for a very long time. What we don't do is post on Facebook pictures of our ministers visiting them and handing out food to the poor, because what you should do in Northern Ireland, and you're the leader of Sinn Féin in all of Ireland, is make sure that the Northern Ireland Executive matches what we're doing. And again, we saw the two faces of Sinn Féin when it comes to business grants, and the Deputy is correct. They are doing more for business than they are doing for the unemployed in the north. When it comes to business grants, it's because Sinn Féin's in government. But when it comes to their failure to look after those who've lost their jobs, as we have, it's somebody else's fault. People need to see through this. Everyone in this chamber does.
Thank you, Taoiseach. Deputy Evan Ryan, please.
You might ask a question of the Taoiseach. I want to make a statement. Starting with the fact that our hearts goes out to the families of those 36 people who died yesterday. And it was interesting, Ceann, I the other day listened to radio, and I think it was Ryan Tubridy was on an interview with someone, and the person asked, how is Ireland at the moment? And one of the things he said just in a short response is, it's good because our political system listens to health advice. And it just struck me as a very simple truth that is important, that is a good thing. And it's worrying, therefore, that while there's a lot of good signs, the fact that the ICU numbers are down and the transmission rates are down, but those numbers of deaths yesterday announced was a real shock, I think. Well, an ongoing shock for everyone. And that Dr. Tony Hoolan is saying, as I understand today, that if he was to give advice tomorrow on terms of whether we'd ease the restrictions that are due on the 18th of May, he'd be reluctant to do so is a concern. And that he says that there's still community transmission, and we can see it in the numbers, is also a concern. I also heard today, you hear different things, I think it was Alistair Campbell in the UK saying that, okay, yes, follow the scientific advice, and he needs to know, but we need to know the science, we need to know the figures. I say by that as a way of a long introduction, maybe to referencing Deputy Howland beside me, because he introduced the Open Government Partnership, as I recall, back in 2011. And I do think in the following scientific advice and in maybe returning or really emphasising that capability to provide open government, and particularly around information in a scientific way, is very important in this time. And I connect that, if I can, Corla, to another comment in recent weeks from our President, Michael de Higgins, who, in I think a very important article in the Sunday Business Post, referred to a report from the National Economic and Social Council that I think gives us a map for some of the ways we can manage the recovery here. To quote the President, if that's not running into difficulty, says, the report that NESC provides is a map for recovery exists. Let us be wise enough to use it. And that report, again, the reason why I'm connecting this is because it refers to two areas of transformation that will help in the recovery. One is in relation to our reduction in climate emissions, tackling that huge challenge. But the second is around the whole issue of digitalisation and how we, as a country, make sure we deliver a just transition in that, as well as in our approach to climate change. And the two are connected. And that, I think, as we start to manage the opening up of our recovery, does give us a guide as to where to go. And put simply, I think if I was to simplify down some of the recommendations within the report, which the President describes as important as the one as Whitaker wrote in going from this country being a closed economy to an open economy, this is steering us on a map from going from being an unsustainable one to a sustainable one. But it very much emphasises the local, the need to work at a local level in devising this transformation. It refers, I think, or it would reiterate what I think the European Commission and others have been promoting, open innovation, they call it, Open Innovation 2.0, where there are 4 strands of cooperation you need, with the state centrally involved, with business, with academia, and with local communities and with citizens. And I mention that because I think that is how our recovery will work. It will start from the bottom up. It's important that we support particularly small and local businesses, that working with our universities, working with the state, working with other local people, agencies of the state, we can and will turn this economy around. And doing it in a way that uses the solidarity we've shown in response to this crisis is what we need to do. And that relates, first and foremost, I think, to the health system. What we've seen in how we've managed our health system in this last 2 months is just such an example of how innovation, we can be good at this. The fact that we've turned around our health system very quickly and been able to build new extra capacity in the ways that we would never think that we could do in the timelines we've done is just such an example of such innovation. The use of such digital technology now, Taoiseach, I recall you speaking recently about how online clinics are now being done in a way that haven't been done previously, and we should maintain that capability. The fact that as we introduce contact tracing apps, we have to have the trust and confidence of our people that actually this is really good digital innovation is going to be critical for managing the continuing suppression of the virus. So I'm sorry if that sounds slightly abstract, but the ability to innovate and the ability to involve our local communities and our businesses and our universities and the state in such a 4-stranded approach to innovation is going to be the key to recovery. And that starts, more than anything else, with collaboration in the political space and actually cooperation with our local government and with all our parties so that we're all in that sort of collaborative, innovative approach to the recovery ahead of us. Thank you, Ceann Comhairle.
Deputy Joe O'Brien.
Ceann Comhairle. I do have questions and I will leave some time for some answers. Taoiseach, I refer to the situation of thousands of people in institutional communal accommodation called direct provision. And I note this in the context of huge national and governmental effort to tackle Covid-19, where there's been a huge communication campaign to inform everyone about what they need to do in terms of social distancing and how to protect their health and protect the health of their communities. It's also in the context of government releasing an unprecedented amount of funding to protect people's incomes, their livelihoods and their lives, and taking dramatic steps that have never been taken before. So it is in these contexts that it is particularly difficult to understand the government's response to people living in direct provision. Taoiseach, my figures tell me that there are 1,800 people still sharing a bedroom with people they are not related to and do not know. My first question is, can you confirm this? The HSE came up with a new definition of household in order to work around Tony Holohan's advice that social distancing is not possible for people in communal bedrooms such as these. It would now appear that a household can mean a group of people who have never met before, are from different countries, speak different languages, didn't choose to live with each other, and naturally don't have the knowledge of each other's movements and activities during the day. Frankly, it's scandalous in these wider contexts that I have outlined that this fudge has been actively implemented where people, despite their best efforts, and I spoke to a man this morning who was in desperation trying to comply with social distancing in a direct provision setting, that this is actually happening. And it's causing a huge risk to their health and active damage to their mental health, which in many cases was already under severe strain. How would we all feel if we were unable to actually comply with the social distancing measures that have been asked of us in the last few weeks? Now, I understand, but I don't agree with the communal accommodation setup that has been the way that is direct provision, but it is inconsistent with public health needs at the moment. What's more, the fact that a new centre was set up during the pandemic, which forced people into communal bedroom situations, is mind-boggling when we are supposed to be pulling out all the stops. Taoiseach, I have figures of 5,866 people in direct provision and another 1,585 protection applicants in emergency accommodation. Can you clarify how many of these people have been tested, how many have tested positive, and how many have now been provided with their own bedroom where they can isolate? The approach to protecting people's health in direct provision is an active failure, and we now have a legal opinion emerging from the Irish Refugee Council contending that it is also a breach of various human rights commitments. It's not that the government didn't move fast enough or didn't understand the reality. It's that you knew it wasn't the best approach and you carried on anyway. Taoiseach, we must do better.
Thanks very much, Deputy. I'm afraid I can't confirm those exact numbers. I don't have them in front of me, but they may well be correct. They certainly sound like they are correct. The definition of a household or a bubble, as some countries use, is not unique to Ireland. Essentially, from a public health point of view, the household, or your bubble, as some countries are now referring to it, are the people you live with, because it's virtually impossible to maintain a social distance from people who you live with. And there are lots of people who share a house with people who they're not related to, and they are considered the one household. And there are many people who share a room with somebody they're not related to, and they are considered to be the one household or the one bubble, because it's not practical to socially distance and isolate yourself from people you live with, whether it's the same house or the same room. You are therefore considered to be a household or a bubble. So there was no change of definition there. It was always a definition, and it's just common sense if you think about it from a public health point of view, and applies whether you're in direct provision or not. Doesn't matter what language you speak, your household is the people you live with. And if you share a room, that's your household or your bubble. In relation to people who need to be isolated, City West is available, and people have been isolated there, and there is capacity there, and also the possibility of isolating people in hotels if they need to be isolated. Again, I don't have exact figures in front of me. I'll correspond with the Deputy and provide him with those figures. In relation to direct provision, I don't think anyone in this House believes that direct provision is a good system, and I absolutely believe it should be one of the objectives of the next government to put an end to it. But it's easier said than done. There is a shortage of accommodation in the country, and it's difficult to predict the number of people in any given week, month or year that are going to come in from overseas and may need accommodation.
Thank you, Taoiseach. Now, Deputy Alan Kelly, please.
Thank you, Ceann Comhairle. I want to begin again by paying tribute to all our workers who are doing such amazing work for us all at this time, particularly those on the front line, and to offer my condolences and that of my party in relation to all the families who have lost loved ones over the last week. Taoiseach, I want to raise 4 issues with you today. I'm back on my transparency issue. I want to significantly concentrate on secondary non-COVID morbidity, because it's a real issue. The disability sector, which I think is a sector that's actually been forgotten about, and also childcare. But before I begin, I just want to say that the handling of the Leaving Cert has been an unmitigated disaster. So please intervene. The stress that these students have been put under has been intolerable. And this needs to be finished. We need a plan B, and it needs to be out there this week, and it needs to be agreed. This cannot go beyond this week. It is unfair. It's completely wrong. And the handling of it from the Department of Education has shown a dysfunctionality that hasn't been seen in some while. Taoiseach, 2 weeks since I wrote you asking a number of questions regarding decision-making on NPHET. You didn't really answer my questions, so I wrote you again last week, and you haven't replied. Now we notice that NPHET hasn't published any minutes again for the last six meetings. This was meant to stop. It hasn't. Interestingly, in your letter to me on April the 29th, you said that the famous 100,000 testing target was set at the NPHET meeting of April the 14th. However, the minutes of that meeting have no mention of it. So how could they be set at that meeting? You correspond to me and say that's where it happened, but the minutes don't reflect that. So what's going on? This is deeply concerning. I've also asked you to publish the letters written by the Chief Executive and Chairman of the HSE to the Minister of Health and the Department of Health, and they still have not been published. So I'm asking quite publicly for the third week in a row, why not? What are the government afraid of in these letters? I'm getting worried, Taoiseach, about the reputation of this government for transparency when it comes to answering questions, when it comes to freedom of information, when it comes to the use of GDPR, and the volumes of times that answers are not being given or people are being fobbed off, whether in political or journalistic circles. It's happening too often. The publication of the roadmap last Friday was very welcome. However, the government was very quick to rule out that there were any divergence in views between the government and NPHET. The CMO, Minister Harris, on Friday evening, at the press conference said that the government completely followed the plan. The Taoiseach has recently said the same thing. Yet Philip Ryan in the Irish Independent twice this week has shown that this factually simply is not the case. This is an undeniable fact now. So I've been trying to get a real insight into the government's relationship with NPHET, hence all the questions that haven't been answered. I want to know exactly why did the government choose to deviate from the CMO's advice on the wearing of face masks and on cocooning. Others may not have noticed, but there were also changes in relation to social visits, in relation to retail services, and specifically in relation to travel measures across the grid. I really am concerned as to why the government are afraid to explain all of these. Why are they afraid to admit that they disagreed with the CMO and NPHET and didn't implement 100% their plan? NPHET advises governments make decisions. I don't understand why you can't just admit that and we'll all move on. For me, it isn't actually a big deal. For me, it's actually possibly a good thing, because I believe you're going to have to deviate, take into consideration secondary morbidity, other social economic issues into the future. But I'm concerned, indeed it's very worrying, why you're not willing to be open about this. Very open about it. And it consistently has been denied. In relation to that issue of face masks, very pointedly, Taoiseach, we need a plan. The government needs to give guidance on this. Its messaging on it has been all over the place. And secondary morbidity, we're facing into a catastrophic situation, Taoiseach, unless decisions are made and made quickly. As COVID-19, thankfully, hopefully, becomes more controlled, and well done to everybody for all their work, and because of the way society has now been socialised around COVID-19, we know that there are people dying from deaths that are preventable in normal circumstances. 30% of clinical healthcare appointments are not being fulfilled, 30% drop in inpatient activity, 50% decrease in GPs referral to rapid access clinics. In the UK, they've made an assessment that 18,000 more people are going to die from cancer. We've no screening programmes, scale back diagnostics, trim down community work, and a drop-off in mental health and disability services. I know of one woman who has been told she's going to have to wait 24 weeks for a colposcopy test results. We've been here before, Taoiseach. We can't go back there. That is not acceptable. So we need a public awareness campaign to ensure people re-engage with the health service, and patients need to be assured that if they go to a GP or need a hospital appointment, that they can do so, and it will be safe. This campaign needs to be backed up by a plan to get our health service moving. I believe that the roadmap that you published actually has a huge gap in it. It needs a correlation of a plan in relation to how we're going to get our health service moving as well in tandem. So I have a critical question for you, Taoiseach. Who will draw up this plan? Is it NPHET or the HSE? It cannot be NPHET. It has to be the HSE. Please assure us that that is what? A plan for reorientating, redeveloping, restarting the health service. It has to be the HSE. It cannot, in my opinion, be NPHET. They have a certain mandate and a certain competency, but it's the HSE's role to deliver health services in this country. Otherwise, the board of the HSE and governance of the HSE may as well not be there. I think an issue missing here from the puzzle is obviously the whole issue of normality. And I do fear that in order to get people back to going to their appointments and re-engaging, that you're going to have to re-look at the roadmap as regards these 3-week intervals. Because I predict that you and your government will reach a pendulum point, Taoiseach, in the next few weeks, where non-COVID preventable deaths could possibly outweigh COVID deaths. And this is something you're going to have to consider carefully. How healthcare is performed has changed, how we're going to configure attendances at clinics, where people are going to wait, the use of PPE, all of this needs to be prepared for and changed. And we also know there's a real danger coming down the road with the winter flu. So Taoiseach, please take on our request in the Labour Party and just give the flu vaccine free to everybody for the next year. We cannot countenance the idea of dealing with COVID and the flu at the one time. So please, please do that. I think everybody in the House believes that's a good idea. When it comes to, there's been an awful lot of good innovations that we need to keep, Taoiseach, collaboration with GPs, e-health, video and phone consultations. But we also need to ensure that we do what Paul Reid said at the beginning. We have sláinte care on speed. The nationalisation of some of our private hospitals for the 3-month period hasn't been optimal, and that needs to change. But it is a good thing, and it is something that needs to continue. We need bed capacity. Sláinte care identifies it. This is the quickest way of doing it. And I had to say, I cringed when I saw in prime time a certain consultant who said that he didn't care, really. He was agnostic as to how people, what door they came through, public or private, as regards treatment in his clinic. But that same consultant has not signed up to work under the current COVID arrangements. I dare say that consultant would care if a patient couldn't pay. That needs to change. In relation to disability services, Taoiseach, I do believe that we have taken our eye off the ball collectively here. Many people with intellectual disabilities, I'm hearing, are suffering greatly. And the lack of assurance as to when day service and specialised services are coming back into place needs to be addressed, and needs to be addressed immediately. Many of them have underlying illnesses. Finally, Taoiseach, in relation to childcare provision, I don't believe the government have got their heads around this. I saw 8 weeks ago the plan that the Minister for Health had in relation to this. He showed it to me, in fairness, that he had it. The fact that it's taken this length of time isn't acceptable. I also believe the idea that we don't have the detail on it worked out by now isn't acceptable either. But also, Taoiseach, I don't believe the plan as regards childcare opening and the intervals is acceptable. I don't believe it's going to work, because we need to mobilise and get people into a normal system again. And the way in which childcare has been phased in is going to have to be brought forward. Also, the whole issue of maternity leave. Women who have had children and are on maternity leave, you need to consider extending that, because they haven't been able it hasn't been a normal situation where children have been able to be with their parents over a considerable period of time. So I'm asking you to consider extending maternity leave in some way so that these parents can look at how childcare provision can be brought about and can actually be able to embrace that period with their children. I do believe there will be an issue with some childcare providers as regards taking on young babies in the current circumstances, and the government needs to consider this and plan for this as well. Thank you.
Thank you very much. Deputy Róisín Shortall.
Yeah.
The provision is made in the order for... Sorry, deputies. In the order for today, the provision was made for questions and answers. If members decide to consume all the time asking the questions, then they can't expect to get answers. So, Taoiseach, if it's possible to correspond, if that's possible, that's
Thanks.
fine. Deputy Shortall.
Okay.
Sorry? Well, I don't know. I mean, it was open to you, Deputy, to give the Taoiseach 5 minutes to answer. But anyway, Deputy Shortall.
Thanks, Ceann Comhairle. People are raising all kinds of different issues, and the longer we continue in this health crisis, the deeper we get into an economic crisis as well. And there are so many different aspects of life. Practically every aspect of life is impacted by the virus and the associated economic recession that we're in. But I want to just take us back to stage one in this government's response to this virus, and that is the strategy that we're pursuing in this country to contain the virus. And that is a strategy which is about test, trace and isolate. And, you know, some of us feel like a broken record on this because the issue hasn't been addressed by government in the kind of scale that is required in order for us to be successful in beating this crisis, and in order for us to be successful in actually being able to progress through the roadmap that has been set out. And there remains major question marks over our ability to do either of those things. Look, it has been set out from the very beginning that, you know, the strategy here is going to be to test at the level of about 15,000 a day, to have quick tracing and quick isolation. And that's the way you control the virus. That's the strategy. And, you know, the Taoiseach can quote figures from other countries, but other countries are using different strategies. And look at those other island countries that have been using very successful strategies. For example, New Zealand, Iceland, where they clamped down completely on traffic in and out of the country. We actually did the opposite, and we made very serious mistakes in relation to allowing travel from particularly dangerous areas to continue unabated. And to a large extent, you know, we're still allowing that to happen, movement of people back and forth. And we saw that Aer Lingus flight there on the news bulletin yesterday, a flight where there was no social distancing respected at all. Is this continuing? How many people are coming into this country in those kind of circumstances? Where are they coming from? And we know the very kind of weak arrangements that have been put in place at our airports in terms of handing out a leaflet and now asking people to give details and their phone number. The people just are not cooperating with that. So, look, our strategy, for better or for worse, is a test, trace and isolate strategy. And I don't know why, Taoiseach, you are playing that down so much. I don't know why you haven't been upfront in terms of telling us what the situation is about the numbers, the reasons why we haven't met the kind of target numbers that we were supposed to do weeks ago, and why you won't explain to us here and to the general public what the issues are with that. I also noticed last week when, you know, public attention was focusing on this, that you, Taoiseach, and the Minister for Health both kind of went out of your way to clarify that we're not talking about 15,000 tests per day, but we're talking about a capacity for 15,000 tests per day. And why are you making that distinction, Taoiseach? I mean, all of the medical advice is that we need to be testing at least 15,000 per day, and we need to be able to trace very quickly and isolate where necessary. So why are you going against medical advice in that regard? And why are you not explaining to us what the position is about that strategy? You know, it's been made very clear by the CMO that while at hospital level and in relation to healthcare staff, and now very belatedly in relation to staff and residents in nursing homes, that there is an adequate level of testing going on there. But the difficulty is, and as the CMO has pointed out very clearly, we do not understand the behaviour of the virus at community level. And we will not be able to understand the behaviour of the virus at community level until there's an adequate level of testing and tracing going on. So we're very, very far from getting on top of this virus. The CMO again has said that, we need to be doing that number and we need to be getting results very quickly. And the difficulty now in terms of proceeding with the roadmap is that the kind of spacing that you are proposing between the different phases of that, a 3-week spacing, will not allow time under the present arrangements for cases to be detected, tested, traced and isolated. And we won't have that data back in order to determine whether it's safe to continue to the next stage or not. We know that a number of very prominent medics and scientists in this country have said that the likelihood is that there are hundreds of thousands of cases in the community here. We have no handle at the moment on those numbers. All we know is the narrow number of people that have been tested, and we know something about their cases. We don't know anything about community cases. And I really think, Taoiseach, that you are jumping the gun in relation to this. I know everybody likes to have good news and everybody likes to talk about returning to normal, but we do not have the basic strategy right to allow us to do that safely. And the big fear, of course, is that there will be a second wave of this virus. And that is a disaster. It's a disaster for everybody, for our health. It's a disaster for our jobs, for our business. And, just try telling people 3 or 6 weeks into the roadmap that we have to go back to stage 1. And we will have to go back to stage 1 unless we get the strategy right. Look, we talk about this, and then we look at what's actually happening in the real world. You put in place a very expensive infrastructure for testing and tracing. You recruited hundreds of thousands of people to engage in that important work. What's been happening in recent weeks is that many of those test centres have been closed down. In fact, most of them, big ones like Croke Park, like Taoiseach Stadium, for example, were closed all weekend. They were closed a half day on Tuesday. Why is this happening, Taoiseach? Can you explain why that's the case? This is the most urgent thing that we need to be doing, and yet we're standing down staff that are ready and able to do all of that important work. Places are closed. As far as I understand, it's fundamental to everything else that's being done, and it puzzles me greatly. I don't know that anybody can explain why it is when we need to test and trace.
Thanks, Deputy, for your questions. Just in terms of our strategy, our strategy is to have the capacity to test 100,000 people per week, and to do so with a rapid turnaround, and to do so with rapid and aggressive tracing there following. And that's not contrary to the medical advice or the advice of the CMO, as the Deputy contends. The reason why the testing centres have been underutilised in the last couple of weeks is because of the clinical criteria for testing. And now that those have been relaxed by NPHET and the CMO, I expect we're going to see them being used much more than they were previously. The decision on the criteria for testing is entirely a decision for the CMO and for NPHET, and I think he's best to answer that question. Not a government decision at all in any way. In terms of the 3-week interval, the World Health Organization recommends 2. The ECDC recommends 4. The incubation period is between 5 and 11 days, and that's why 3 weeks has been chosen. In relation to New Zealand, I think it's important to say that we have now tested more people per head than New Zealand, considerably more. And I don't think New Zealand's comparable. It's in the southern hemisphere. We're in Western Europe, which is the epicentre of the virus. New Zealand is 3.5 hours flight from Australia, which is even less affected than them. They've even fewer cases per head. We share a land border with the United Kingdom and a common travel area with the United Kingdom, and we're part of the European Union. And the flight the Deputy mentioned is a perfect example of how we're different. That was a flight between London and Belfast. It was a flight within the United Kingdom, a flight that we'd no control over. And the only way we could have stopped people travelling from that flight to this jurisdiction would be to seal the land border between Northern Ireland and the Republic of Ireland. We are certainly not going to do that.
Thank you, Taoiseach. Now we go to Solidarity. Deputy Boyd Barrett sharing with
Solidarity
Deputy
People
Barry.
Before Profit, and I'd be sharing time with Mick Barry, and according to the question and answer format as agreed by the Business Committee. Taoiseach, Today, People for Profit and Solidarity TDs launched an online petition calling on your government to abandon plans to cut or taper the 350 pandemic payment, at least until the pandemic has passed and all the employment losses and economic impacts of the pandemic have been overcome. And we further call in that petition for the payment to be extended to groups who have been unfairly excluded from it, most notably those over 66, those under 18 and people in the gig economy and precarious work who have been unfairly excluded. And we further call for a review, because we believe the 350 payment figure, which the government was forced to increase to, was an admission that it really is impossible for people to live any kind of dignified existence below that. And as Social Justice Ireland have pointed out, huge numbers of pensioners, job seekers, people on disability are living effectively on poverty payments. So I'm looking for that commitment, particularly in response to the clear hints that have been coming from yourself, from Pascal Donoghue and Regina Doherty about cuts or tapering in the COVID payment. Wouldn't it be completely unjust, Taoiseach, to further cut the income of workers who have lost their jobs through no fault of their own before this pandemic has been overcome and the full economic impact of job losses have been overcome? And will you agree that there will be no cuts or no tapering until we've overcome this pandemic?
Deputy, I think I answered that question in response to Deputy MacDonald earlier. We acknowledge that this payment is unprecedented, one of the highest in the world, cannot go on forever. That would not be affordable for our taxpayers. But we also acknowledge that it cannot be removed until people have the opportunity to return to their jobs. And lots of people will not have that opportunity this side of the middle of June. So it will be necessary to extend it. That might be a decision for this government. It might be a decision for the next one. We'll have to see how things develop in the next couple of weeks. In relation to people who are in the gig economy, they're self-employed, they can qualify, and lots of people who are self-employed have qualified for this payment. The amount 350 was not chosen for the reasons the Deputy contends. The amount 350 was chosen because that's roughly 70% of the average income of people working in the sectors most affected. That is retail, hospitality and construction, and accommodation and food. So that's how we came up with that figure of 70%. What we originally wanted to do was to give people 70% of what they earned before. It wasn't possible to administer that. People would have waited weeks and weeks and weeks for any payment at all, so we decided on a round figure. That has created an anomaly. There are a lot of people, maybe 25% of people in receipt of that payment are actually getting paid more now in their pandemic employment payment than they were in their working. They're mainly part-time workers. It's not a bad thing, not embarrassed about that. I'm happy we did it, but it is an anomaly that will have to be dealt with in due course. And of course, there's the issue of the over 60s that you mentioned.
First of all, you haven't given a clear commitment that there will be no cuts or tapering until the pandemic is over, and until all the employment lost as a result of the pandemic has been restored. You should give a commitment, and I'm asking for the commitment that the over 66s and the under 18s who are being unfairly discriminated against get the payment also, and that many workers in the gig economy who didn't happen to be working at the time but might have been working a week or two later would also get the payment. And can I add, in addition to that, could you also give some sort of serious response to the plight of the Debenhams workers and indeed other workers who could face cynical exploitation by their employers of trying to throw them on the scrap heap using the COVID-19 emergency as a cover and actually intervene and protect their jobs?
Just over 20 seconds, Taoiseach, for a response on that.
He was over time. That's why.
Thanks, Deputy.
Yeah.
Again, I think everyone in the House knows that these are rhetorical questions. The Deputy asked me, can I give a commitment that this payment won't be ended until the pandemic will end? Does the Deputy know when the pandemic will end? No, you don't. Exactly. So, of course it's impossible to give a commitment. about the pandemic ending when nobody knows when the pandemic will end. It's a rhetorical question, not a serious one, designed to get press coverage and not to get a serious answer.
Barry.
Taoiseach, I want to ask you some questions about the Leaving Certificate. There is clearly now a crisis of democratic legitimacy around this year's Leaving Cert exams. 79% of nearly 24,000 Leaving Cert students, polled by the Irish Second Level Students' Union, want cancellation. A mere 15% want the exams to go ahead. These young people feel that they are being forced to do these exams against their will and that they are in effect being bullied by your government. These young people are concerned first and foremost with their mental health and the mental health of their friends and peers. They do not want to sit vital exams in the middle of a global pandemic in a country with the 8th highest rate of death from the virus per million in the world, when you exclude tiny states. In 20 years as an elected public rep, I have never before seen a government decision cause so much mental anguish to so many young people. So, Taoiseach, my first two questions, and I want to come back with one. Do you accept the findings of the ISSU poll that 4 young Leaving Cert students in 5 are opposed to your government's Leaving Cert policy? And second, do you accept that your government's position on this issue is greatly adding to the mental strain on many, many of our young people? Count Carl, I do want to come back in for a very short question before the end.
Thanks, Deputy. Democratic legitimacy doesn't derive from opinion polls, whether it's a door-to-door survey, whether it's online, and no matter who does it. In a democracy, and this is a democracy, legitimacy does not derive from opinion polls of any sort, of any nature, carried out by anyone. Sometimes I wish they did, because as you know, my own experience is one of doing much better in opinion polls than in real elections. So, Deputy, opinion polls do not confer democratic legitimacy. Elections do, and ultimately this House at some stage hopefully will form a government with democratic legitimacy. In the meantime, I'll work night and day as hard as I can, doing the job that I'm entrusted to do by the Constitution. Deputy, I fully appreciate the stress that sixth-year students are under, the uncertainty. Absolutely understand that, and I still get nightmares about my Leaving Cert maths paper. I know how traumatic the Leaving Cert can be for a lot of people, and we will try to bring a conclusion to this matter this week as best we can.
Deputy Barry.
Okay, I note the Taoiseach's comment about opinion polls, but you swept that one under the carpet quite quickly, Taoiseach, I have to say. Your government meets with the ISSU. You recognise them as, in some ways at least, a representative voice for secondary school students. They conducted a poll and 24,000 students replied in that poll. What they said does not count for nothing. It wasn't 51% or 52% or 53% who said cancel the exams. It was a crushing majority, 79%, nearly 4 in 5. And it wasn't 1,000 or 2,000 who answered that either. It was nearly 24,000 students. And I think they will consider your response to be a little bit flippant and a little bit dismissive of their concerns. You say that you understand and you hear their distress. I had a meeting last night online with 2,500 Leaving Cert students. And yes, they are distressed, and the certainty that they're looking for is the certainty that the Leaving Cert exams will be cancelled. So my question to the Taoiseach is simply this: will you give those students a commitment now, here, today, in this House, that you will cancel those Leaving Cert exams and find a fair and just alternative to them?
Taoiseach.
Thanks, Deputy. I reject your contention. I was neither glib nor did I sweep anything under the carpet. I gave you a straight answer to a straight question. Do I accept the democratic legitimacy of opinion polls? No, I don't. And if you did, Deputy, I imagine you'd be voting for me for Taoiseach, because apparently that's what the latest opinion poll says the public want. Opinion polls are only opinion polls. That's all they are. And I'm surprised that you think that they have some sort of democratic legitimacy when it suits you, but not when it doesn't. In relation to the serious question that you raise when it comes to cancelling the Leaving Cert and proceeding with the Leaving Cert, I totally appreciate that the uncertainty is causing enormous stress for Sixers at the moment. This is an issue we want to resolve. We know it is possible to carry out the Leaving Cert within existing public health guidelines, but it would not be the Leaving Cert as we know it. So if it is cancelled, we have to make sure that we can put in place an alternative that would be fair, and that is extremely difficult. And that is the kind of work that is being done now at the moment, involving the education partners, involving the unions, involving the State Examinations Commission, involving the Department of Education, involving everyone who only wants what's best and what's fair for our sixth years. And that is going to be difficult. But as I say, this is an issue that we do want to bring to a conclusion this week.
Now we go to Deputy Verona Murphy.
In Wexford, several of the finest nursing homes in the country exist, one of which is Knockeen Nursing Home, run by Mary and Nicola Dorn. They're renowned for providing the highest standard of care to their residents. Unfortunately, Nicola Dorn found she had to speak out in the Wexford People this week. The headline stated that nursing home testing was a farce. The nursing home was tested on the 24th of April and waited for 13 days on the test results. And in a bizarre twist, on the 29th of March, a HSE staff member told Nicola Dorn that they had the results but were not at liberty to give them out. However, after the matter was reported in the Wexford People this week, the results were made available within 24 hours after its publication. Thankfully, they're clear. The situation did, however, cause extreme and needless stress on the owners, who were concerned to know that they hadn't COVID in the home, the staff, many of whom were living with people who were compromised, the families of the residents, who were beside themselves with worry, wondering whether their parents were in a nursing home with COVID and possibly infected. On a daily basis, in the national media, government spokespersons are telling us that nursing home testing is being turned around in 48 hours. I, nor anybody that I've spoken to within the medical fraternity or politics, has experienced any nursing home being in receipt of their results in such a time frame. Taoiseach, one of my questions is, can you confirm to the House that all testing for nursing homes will be completed and turned around within 24 hours? After all, NEFIT and the HSE have had 8 weeks to get it right, and the nursing homes who have borne the brunt of the questionable decisions of the state deserve at least the courtesy of knowing that their test results what they are in a timely fashion. Taoiseach, many physicians and doctors that I've been in touch with are completely frustrated with the testing process. They tell me that most of the testing to date has been an absolute waste, and this follows on from what Deputy Shortall and possibly Deputy Kelly had in mind, as the test results were so old that it was impossible to trace all the contacts and those who were tested positive. You know, as the idea behind the model, as far as we're aware of test, trace and isolate, is that this will be done in an immediate fashion. You yourself said that we now have the capacity to test 12,000 people. The question is, what's the capacity to have the 12,000 results turned around in 24 hours? So can the Taoiseach confirm what are the numbers of tests we have, which I think you already have today? You've said 12,000, but the turnaround of delivering the results in 48 hours. What numbers are traced as a result of the positive tests already confirmed? And can the Taoiseach also tell us how many people that tested positive have recovered before they got their results? These figures are the figures that we require to be published to instil confidence and transparency. Taoiseach, I was pleased to see the roadmap. It was produced and it did give hope to people on an eventual easing of the restrictions. However, I do feel that the roadmap hasn't addressed the calamity of testing, and I feel it was a missed opportunity. And again, there's no defined targets laid down for the HSE in relation to testing. The roadmap is like a house, Taoiseach. You can't build a house without a foundation. What we need is a testing roadmap, one with defined targets and deadlines for a testing regime that underpins the opening of your roadmap. People want a clear vision of where they need to be, to see a trigger for each phase to move forwards or backwards. Equally, there's no mention of containment strategy. All of these things are fundamental to the success of your roadmap. I accept that we both know that there have been issues in relation to reagents, PPE gear and the capacity at laboratories. But you must also know that without a roadmap for testing that sets down defined targets to address and ensure results are turned around within 24 or 48 hours, the roadmap leads to a cul-de-sac. We have 8 weeks of lockdown. The public have played their part and the public needs clarity on testing. Can you confirm that such a roadmap will be provided and the date at which it will be provided? Taoiseach, I know that you're only too aware that this is costing the country between 200 and 400 million a working day, and that you must see the need for a roadmap on testing as I've outlined. The nation is at breaking point, being locked up, and testing is the only way and the only safe way of easing restrictions. If the Taoiseach could answer the questions, please. Thank you.
Taoiseach.
Thanks, Deputy. I'll certainly do my best. In answer to your first question, I can't confirm that. 24 hours is extremely difficult to achieve and almost impossible for tests that are sent to Germany, because obviously they have to be flown to Germany. But turnaround times are improving, and they will improve further. And I think people accept that there were unacceptable and inordinate delays some weeks ago. It's far from perfect now, but it is improving. Certainly for healthcare workers and healthcare staff, we have a very quick turnaround, but it is longer for others. The objective is to have results within 48 hours. But can I promise that 100% of the time it will be possible to do that? I can't, and I'm not actually sure anyone's able to achieve that 100% of the time. But certainly we'd anticipate having the vast majority of tests back within 48 hours. I don't have the exact date of the Deputy requests. It may not be available, but if it is, I will ask the Department of Health to provide it to her by correspondence. The roadmap that we produced on Friday was about reopening society, reopening the economy, reopening Ireland. It wasn't a roadmap on testing, but a lot of work is being done to build on the work that's already been done on that by the Department of Health, by the HSE and by NEFID. It is really important that if we're going to proceed with easing the restrictions, that we have a robust testing and contact tracing system in place and operating. But I would point out that there are lots of countries around Europe now that are easing their restrictions. Germany, for example, Denmark, quite soon Spain and Belgium. None of those countries have tested as many people per head as we have, and yet they are proceeding with easing their restrictions. So it's not that one is absolutely totally contingent on the other.
Murphy, yeah.
Thank you. Taoiseach, I wouldn't agree with your last statement. I think, in fact, they are intrinsically linked. Testing, tracing and isolating is the only thing that's going to see the country open up in a regard that it won't have to close down again, because we don't have a testing system. So I would again ask you to ask the HSE to produce a roadmap that underpins your roadmap in the way in which I've suggested, that we set targets, define targets that we can reach through the testing, tracing and isolating. And when you say it's difficult to get tests to Germany, I appreciate that, having been in the logistics industry for all my life, but we have 26 labs here in Ireland. And I'm fully aware that some of them are prohibited for some reason for testing nursing home tests. And I don't fully understand that, but I think it's something that is, without a shadow of a doubt, something that should be looked into. We should be using all of our capacity in our 26 labs. Thank you, Count Corla.
To conclude, please.
Thanks very much, Deputy. I will indeed ask the HSE to produce a roadmap on testing. They may in fact have done that already, but there are lots of documents being developed all the time and lots of drafts that people will be aware of. But I think that would be a useful thing for them to do, and I'll certainly take that up with the HSE CEO. On the final point, there's about 40 labs now that can test for COVID. I haven't heard of any being prohibited from testing nursing homes. Maybe that is the case, but I certainly can't confirm it's the case.
Deputy Murphy, there's little time remaining.
Well, Taoiseach, I just ask you to look into the fact that we're utilising all our lab capacity and that there aren't any prohibitions on testing, because if testing is turned around, as I've said, within the 24-48 hour period, it gives us a much better chance at the contact tracing and isolation model. Thank you.
The Deputy is absolutely right. The quicker we can turn around the tests, the better we can do in terms of contact tracing. But I should point out that contact tracing can start and does start before the tests come back. So if somebody is a suspected case, you can actually start the contact tracing before the test comes back. And indeed, that's what's commonly done in South Korea and other jurisdictions. So again, you can begin the contact tracing even before the test results come back.
Thank you. And I appreciate that, Taoiseach. I have many people contacting me saying that they've never actually been contacted and were clearly in contact with people who had not only been tested but tested positive. I'd also like to say that there is a current report in the papers today saying that we are actually only using 2% of the people who were employed to do contact tracing. And I think that's very worrying. And again, it's something that I think needs to be looked at. After all, look, Taoiseach, I think we're all well aware that politicians make the decisions based on the medical advice. And that's all I'm saying. In order to get our house in order in relation to testing, I think you'll have to take the bull by the horns and put a testing system, insist on a roadmap, which you've already committed to, and thank you for that, but insist on a roadmap that underpins your roadmap. And we may well get out of phase 1 to 5 within or less than the 3-week defined between.
Thank you, Deputy Murphy. Now, Deputy O'Donoghue sharing with Deputy Collins, 5 minutes each, and I think you have a brief
About
statement.
3 minutes, 2 minutes. I'll allow for questions. Thank you. First and foremost, sympathy to all the people that have lost their lives and the families as well, and for the frontline services, a huge well done to them. Taoiseach, you mentioned earlier on about monies being made available for businesses to start up again. Cash flow is the biggest problem for any business. You take small to medium-sized business, when they come out on the 18th of May to start back into work, if they're currently paying €350 a payment, companies are paying fixed costs, insurance, leasing rates, and I know you send a block on a 3-month rate, but still they're coming back into a time where they're going to have rates again. Some of the companies that I'm talking about are paying €8,000 and €9,000 a month between all their charges. Similar to the crash, no credit from any supplier insisted by the credit insurers. So to start up any business, they will need 8 weeks wages, 8 weeks fixed costs, and 4 weeks materials. The banks reply to this. The banks are saying that they are inundated and they are short of staff, and that applications are made up to 6 weeks ago have been told that the staff are working from home with little or no internet and no link to departments. The banks are also saying that we are owned by the state and the stringent policies are too tight and hinder the prolonged decision-making. Again, we need a plan to start companies back up and put a proper in place for them. Minister O'Donoghue said that there was 5 major banks 2 weeks ago here in the Dáil, and he forgot to mention the credit unions. The 5 major banks, with their term loans, they froze the loan for 3 months, but you still had to pay it within the term of the loan. The credit unions in Ireland were the only financial institution that extended the loans by 3 months and gave the full break to the people and the businesses of Ireland. And they're regulated, but still their funds were being over-regulated where the banks were getting extra. Also, I have here that the dental industry were treated very badly during the COVID. Hospital and HSE closed their clinics on the 16th of March, and the dentists were told to keep working. They were offered no PPE gear, and if they had to try and source it, they couldn't. All GPs are getting €30 on a COVID phone call, a capitation fee for medical cash holders, medical card holders. Dentists get nothing. This goes back, and I'll finish up on this. This goes back to the rollout of broadband. They are classified by the NBP that there is 540,000 rural premises have little or no internet service. In Limerick alone, we have 21,024 houses and businesses that have no internet. So it might be fine for if you're within Dublin or in a large city where you have internet, but if you're in rural areas, and especially in Limerick, you have no internet, okay. So that means that you have no business.
We just have a minute to deal with those points.
I think on the Deputy's initial comments, he's absolutely right. Businesses need money, need cash to restart, and he's absolutely correct in that regard. That's why rates are being waived for 3 months. It's also why businesses can reclaim their rates from 2019. So businesses restarting, reopening, can claim up to €10,000 worth of their rates from 2019. It's effectively a rates rebate. 80% of businesses in Ireland pay less than $10,000 a year in rates, so this is particularly advantageous for those small shops, small businesses that we all want to see up and running really quickly, because they're the ones who employ huge numbers of people, particularly around the country and in rural Ireland. There's also the temporary wage subsidy scheme, which will continue, and also the credit guarantee scheme, which will give loans at favourable rates to viable businesses that can pay it back. I hope to Mr Donoghue is in contact with the banks all the time. I hope to be able to meet the banks myself in the next couple of weeks, if not a couple of days, and I'll raise with them the issue of banks not getting back to people quickly enough. Just as a factual mention, we don't own the banks. We were a majority shareholder in 2 of them, and we do need to help the dentists to get back up and running again, and my office is in contact with the IDA about that.
Sympathies, as everybody else here, go to the bereaved and their families at this time. These are extremely difficult times, Taoiseach, and I have a couple of questions, and I'll try and fit them all in the 5 minutes that we face. And I will focus the main pillars, today, and I will focus my main questions on the main pillars of our country: the farming, fishing, and the tourism sector. The constituency I represent, Cork South West, is totally dependent on these sectors to survive. But for that to happen, Taoiseach, the government will have to step up their efforts dramatically. Farmers are in a crisis for a lengthy period of time, but the current Covid-19 crisis could well wipe hundreds of farmers out of business. The fast solution for farmers is inside the meat factory gate, and I ask you, Taoiseach, to intervene and stand up to the superpowers inside that factory gate for the survival of these farmers. But the question that I ask now, first question, is the fishing industry is floating closely to the edge. Trawlers parked up, as well as inshore fishing boats to the pier, some costing millions. Many Irish fishermen and women face ruin unless aid is given. These people can't survive on Covid-19 350 payment. Taoiseach, I ask you, what plan have you in place for these Irish trawler owners and inshore fishermen and women? And also, is the new current discussions between Fianna Fáil and yourselves seriously given serious consideration for a standalone senior minister for fisheries in the new government being set up?
Thanks, Deputy. I'm very aware of the difficulties that our fishermen and fisherwomen are facing at the moment, and I had a conversation with Minister Creed only about that particular matter in the last couple of days, and he, with his European colleagues, is working on a solution that can assist them at this particular difficult time. Obviously, anything relating to conversations on forming a government are a matter for the parties and not a matter for the Dáil just yet.
Collins?
Thank you. Taoiseach, the recent announcement of £4 billion supports and loans are desperately needed now for many businesses in my own constituency, Cork South West, as throughout the country, but are, from what I can gather, dependent on a new government being set in place. Our country is hugely dependent on tourism. Brilliant initiatives like the Wild Atlantic Way lay in tatters, and the job losses are running over 200,000 in this sector. Taoiseach, we see today that a large percentage of people flying into Ireland are not filling the form, asking them how will they socially isolate for 2 weeks. We need to allay any fears in tourism communities, and we need and this can be done if these forms are mandatory in airports and ports, because we need to open the tourist communities, and this can be done if rules can be met. Small retail businesses in smaller towns and villages are suffering, as the big multinational supermarkets are wiping them out. Garden centres can't open, but large supermarkets can sell garden centre products every day. Small retail clothes shops in towns must remain closed, while the large multinational shop can sell clothing every day, which will make it even more difficult for the small retail shops to reopen, no matter what we do. The questions I want to ask you is on tourism, is where I put my question. I welcome any moves that VAT on tourism could be reduced to 0%. I totally oppose your government, who was supported at that time by Fianna Fáil, in the last budget to raise the tourism VAT from 9 to 13.5%. This is prior to COVID, and this led to numerous restaurants and cafes to close their doors in West Cork, as I said, prior to COVID. Minister Griffin yesterday sought support for a 0% tourism VAT. Are you seriously considering this? And Taoiseach, will you consider a standalone minister for tourism in the future government? And final question, Taoiseach, has there been any discussion around the creation of a new tourism task force where there would be voices on this task force from areas of West Cork and other strong tourism communities?
Thanks, thanks, Deputy. As is often the case, the Deputy suggested 2 new standalone ministries, but did not enlighten us as to which 2 standalone ministries he would wish to abolish. In order to make that possible, the Constitution provides for a maximum of 15 senior ministers and only 15. And I'd be interested to know whether it's rural affairs or agriculture or children, or which ministries Deputy Collins would wish to abolish. He may wish to tell us. In terms of the airport forms, they are not yet mandatory. They may well need to become mandatory, and that's something that we're considering at the moment. But I disagree with the Deputy. Making it mandatory for people to fill in forms in order to self-isolate for 14 days when they come to the country is not good for tourism. People are not going to come to Ireland if they have to isolate for 14 days. We need to get to the point where we can have air travel start again. And I want air travel to start again for business and leisure, but that will have to be done safely. And that's being worked on at the moment. Reducing VAT on the tourism and hospitality sector to 0 would be contrary to the EU VAT directive, so that is not possible for so long as we're a member of the European Union. But it would be possible for the next government to reduce it should they choose to do so, but that would be a matter for the next government. And yes, absolutely, I think we will need a tourism recovery task force, as we did in the past, to get tourism going again. I had the privilege of being Minister for Tourism in my first job in government, and was able to oversee the implementation of the last report of the last Tourism Recovery Task Force, which led to record levels of tourism in Ireland, and I think that is possible again.
Thank you, Taoiseach. Now last, but by no means least, Deputy Catherine Connolly, sharing with Deputy Harkin.
Taoiseach, you might come back and just confirm that it's not your intention to abolish the Department of Children and Youth Affairs, now that that's been raised, albeit in a joking manner. I have just under 5 minutes, so I have one question really, and I'm going to preface it with, I'm going to follow it with a number of comments. But the question is in relation to children with autism, and you're in receipt, and children with special needs of all sorts. And I understand you're in receipt of a letter from a man, describes himself as a professional, but he's not writing to you in that capacity. He's writing in a personal capacity, telling you of in relation to his child, 13, with autism. And he's speaking not for himself, and he recognises that in a sense they have a privileged position in the sense of relatively well off, but he's highlighting the fact that no provision has been made at all with children with disability. We had been holding on to the hope that there must surely be some recognition of the need for some relief for this group in the first state of lifting social restrictions. They are amongst the most vulnerable people in our society, and I quote from his letter, which I'm sure you've read. It is a grim indictment of us as a nation that their education and welfare appears to have been cast aside for 6 months without a documented rationale or justification for an intended good. Without a documented rationale or justification. Many other letters, somebody else referring to their child, severe learning disability and epilepsy, non-verbal and doubly incontinent. He needs and breeds routine, structure and certainty. So my question in relation to that, as well as highlighting it, what impact analysis has been done on the decision to ignore this part of our society? What voice is on that expert committee to raise and to speak for these voices? And finally, I just want to say in relation to testing, I listened to the comments again from Deputy Shortall, and I absolutely agree with her in relation to testing. We talk about misinformation. The best way to deal with misinformation is accountability, openness and facts. And we had 4 testing centres in Galway, now we've 3. We were told by the World Health Organization to test. That hasn't happened. And I believe that hasn't happened, not for clinical reasons, because we simply didn't rise to it in terms of structure and money. And finally, This did not come upon us from nowhere. We prepared in 2007 for a flu pandemic. I understand in December there was an interchange between Micheál Martin, Deputy Martin, and yourself in relation to an emergency coordination centre, in relation to an emergency plan. And you said at that time it was imminent. So what happened to that plan? That's an accessory question, but I'm leaving 2 minutes in relation to the children with disability.
Thanks, Deputy. I have to confess to not having read that letter yet. I'm sure you'd appreciate I receive thousands of individual items of correspondence to my office every week, and it's not possible for me to read them all. But if you want to perhaps pass on privately the name and address, I'll check it out and ensure that he receives a proper reply. In terms of the voice of disability, we have a minister at the Cabinet table responsible for disability, the first government ever to do so, and that is Minister McGrath. And at every meeting of the Cabinet, he always reminds us of the importance of disability issues, ranging from the need to look out for people with disabilities living in residential care to the difficulties around people.
My question was, who is the voice on the NEFIT committee? That's my question.
We hear it.
Yeah,
yes.
No, there isn't on NEFIT. There isn't anybody who's any voice for any particular subgroup in society, whether it's women or men, whether it's business people or workers, whether it's people with disabilities, whether it's older people or younger people. That isn't how NEFIT.
Sorry, Taoiseach, who carries out the impact analysis in relation to decisions like this, where this sector has been left completely on the side with no provision?
Just hear the Taoiseach, please.
Deputy decisions are made by government, not by NEFIT. NEFIT advises government, and at the Cabinet table there's a minister whose responsibility is for disability, and he is the voice of these matters. Where NEFIT acts entirely independently of government, it's on those matters that are solely matters of public health, such as the clinical criteria for testing, so on. But political decisions are made by government. Just in relation to the pandemic plan, there is a national emergency plan and there is a pandemic plan. As the Deputy rightly pointed out, it was a plan for an influenza pandemic. We have been able to draw on that in the last couple of weeks. But the reality of a coronavirus pandemic is somewhat different to the influenza pandemic, which was predicted.
Okay, thank you, Taoiseach. Deputy Harkin.
Thank you, Ken Corlett. Taoiseach, just 3 questions I want to ask, and I will leave some time. My first question is around the wearing of face masks as a containment strategy for COVID. I think the science and the evidence is clear. Yes, there are issues about how we wear them, but not whether we wear them or not. And there are concerns around supply and cost, but homemade masks require a needle, a thread, a piece of material, and for some of us, a little tuition from YouTube. But I know, for example, of a group of volunteers from Sligo, Leitrim, Roscommon, Donegal. They're called Northwest Sews Masks and Gowns. They have supplied 500 scrubs and 4,000 masks nationwide with the help of the Gardaí. They have fundraised, and they and other groups would be willing to upscale. It might even become a small income stream for some people. So I want to ask you, how soon can we expect guidance on masks? Secondly, you've already answered this question about the public health passenger locator form, but I want to emphasise to you that our own citizens are not allowed to move more than 5 kilometres from their own homes. So if you're not going to enact legislation to require incoming passengers to sign this form, how are you going to close that gaping hole in the containment strategy for COVID? And my third question is around our local authorities. Many of them are on their knees in respect to resources. It's not just collapse of rates for 3 months, it will be the end of the year before this is sorted. There's a collapse in other revenues, parking charges, charges for planning applications. They've disappeared. There's increased costs around COVID. And can I take this opportunity to thank our local authorities for the sterling work they have done in this instance. But I want to ask you, what plans do you have in place to support our local authorities who are literally running out of money? Thank you.
Thank you, Deputy Taoiseach.
Thanks very much, Deputy. The wearing of face masks and face coverings is in fact still very much a matter of scientific debate. I know some scientists speak about it with great certainty, but certainly within the expert advisory group and within NEFID and within the World Health Organization, the ECDC, the CDC, you name it, you hear different advice because there isn't a scientific consensus on this matter. The research that has been done has largely been done in healthcare settings, not in the community, and has been done more generally and not specific to SARS-CoV-2. And therein lies a difficulty. But the advice currently from NEFID is that healthcare workers should wear a face mask and that those with symptoms should do. And they're considering now whether to extend that advice more widely. And of course, there are different types of masks: surgical masks, respirator masks, face coverings, and we do have to bear in mind the risk of a lack of supply. We don't at the moment have a problem with the supply of face masks, but if we ask people to wear 2 or 3 or 4 a day, having 16 million a day available is difficult. So, you know, it's not the slam dunk that the Deputy may suggest it is, but it is something that is very much under consideration by the National Public Health Emergency Team. On the passenger arrival form, we are considering regulations to make that mandatory. We don't need primary legislation. It's possible for the Minister for Health to make regulations under existing legislation, and that is under consideration. In relation to local authorities, the Deputy makes a very good point about local authorities being under some difficulty with their funding arrangements at the moment. The 3-month rates waiver will help them because they will get that money from central government. And they'll actually get more than they would have got in because you never have 100% payment of rates, but we will give them the 100%. So that'll be a bit of a cash boost to them. But I fully appreciate that they're going to have other lost revenues in other areas. And we will work with local authorities on that. But I also need to be very frank with people as well, whether it's individuals, whether it's businesses, whether it's public bodies, local authorities, state agencies. It may not be possible for the taxpayer to compensate everyone for everything they've lost. That just may not be possible. But we will do the best we can within the resources we have.
Agus